Hello, everybody. I think we do have Arjun Panesar on the line now. So, Arjun, if you can hear me, then you can just share your audio and video, and we'll be able to hear your talk. Excellent. Over to you.
Hopefully that's come through. Brilliant. Awesome. So, sorry for the catastrophe of this morning. Anyway, I haven't got a presentation to share. I was really just going to talk through the benefits of our intervention and what we've been doing over the last 3, 4, 5. It's really been some time. And then hopefully, if we've got a little bit of time, I'll open up the app and actually show some areas of how we bring AI and digital therapies to life. So, thank you for having me. My name is Arjun Panesar. I am the CEO and head of AI at a company called Diabetes Digital Media, which I co-founded with my colleague Charlotte Summers. We provide essentially digital health technologies or apps that are multi-platform. So, we're not just talking about sort of mobile devices such as iOS and Android, but we're talking about sort of VR, voice-activated assistants, really the whole plethora of digital devices that we have today. And we create apps that sit on these devices and act as software, but they are regulated as a medical device. And these medical, softwares or software as a medical device applications are used by around about 1.8 million people in 6 markets, including the UK, Ireland, Canada, Germany, Switzerland, and India. And they're available in a number of languages as well, so available in 6 languages as well. What we've done over the last 5 years really is collect an enormous amount of data on people using digital health interventions, not only in diabetes, obviously, which is an industry that we're part of, but sort of, people who have diabetes have a range of comorbidities or other conditions. So you may have hypertension, you may have cardiovascular disease. There are so many other diagnoses of conditions that it gave us the ability to analyze people as essentially as neural networks or as data points. And when we come to talk about digital therapeutics, we're really talking about digital medications and digital softwares being able to support treatment pathways. So with the people that we had within our platform, which is around about 1.8 million people, we surveyed and understood the needs of that community and how they felt, how they best felt that they could be engaged. And we developed an intervention called Grow Health, which has been in existence now for around about 12, 18 months, that looks at tackling non-communicable disease by addressing the core pillars of health. So nutrition, activity, sleep, and mental well-being. And so, when we talk about digital therapies, really they help us achieve the pinnacle of evidence-based medicine. And essentially that is personalization of your experience, but personalization of your treatment. And when we're talking about digital therapies, you will be able to, or one day will be able to personalize your therapy down to your genome. And so how do we start that? We start that really from data. And so as users join an intervention, they may state their age, their gender, their health condition. They may state, how much they earn, if that is relevant, perhaps. They may, they're essentially creating that profile of a person in order for us to create an understanding, essentially, of that user's desires, that user's requirements, but essentially the behaviors, what that user wants and where they are is essentially something that we can track in real time through the use of mobile devices and different types of devices. So Grow helps to empower people by essentially allowing you to focus on an area of your health. So if you have type 2 diabetes, for instance, you may want to focus on nutrition. If you have stress or anxiety, you may want to focus on mental health. But by allowing users to pick and choose what they want to focus on, we are able to personalize that structured education to that user's disease profile, their ethnicity, their age, gender, and location. And when you think about digital therapies, people often refer to the fact that they don't engage the hard to reach. And I'm glad to say that a lot of the research that we have been conducting has been looking at how different communities engage within digital health interventions. And one of the things that we have taken steps to make sure that we achieve is looking at the the language is spoken within, within the countries that we work in. So in the UK, for instance, we support Arabic, Hindi, Punjabi, Urdu. How can you engage the communities that are often considered hard to reach? It's actually a lot easier than many people think. And one of the easiest ways to start is really by engaging people in their own language. And within Grow Health, if you are looking, or you are engaging in nutrition or sleep or mental well-being, whatever that may be, the way that you are spoken to, the language that you are spoken to in, all of that is adapted to make sure it is culturally and socially relevant and doesn't isolate that person from what they expect. We then provide resources, and so with digital therapies, it's not often that the digital device or the digital software itself achieves the outcome. It's quite often requires human intervention, and so the resources that we provide are essentially those interventions, and they are tailored to what users would like. So if you can't sleep, you may see bedtime stories or music to sleep to. If you are saying you would like to be more active, you may see activities and workouts or on-demand classes. And if you said you wanted to optimize your nutrition, for example, you would receive personalized recipes and meal plans. But really the strength of a digital therapeutic, and particularly today, is bringing together the data exhaust that people are creating, from wearables, clinical devices, self-reported data. And by being able to track those biomarkers, digital therapies allow us to understand not only the health data, but the health data in context to their behaviors, to their location, to their demographics. And so what we have been able to do is essentially create AI that is able to crunch this health data and output a wellness score, or sort of metrics that help to determine how well rested a particular participant may be, and essentially providing data-led insight able to empower the users to make decisions, every day in regards to their health and well-being. When we come to COVID, it's particularly important to support patients at risk of conditions such as type 2 diabetes, such as hypertension and obesity, because they have been determined to be such big factors in COVID-19 and its complications. And remote monitoring is a key piece of that. So digital therapies allow us to monitor remotely as well. And the dashboard that we have has been co-designed with physicians in the University of British Columbia in Canada, in order to ensure it's clinically validated and able to be scaled within territories, sort of remotely and at distance. So what are the outcomes of digital therapies? And it would be incorrect for me to say that digital therapies are going to solve everything, because they absolutely aren't. However, COVID has shifted the adoption of digital tech by at least a decade, and so we now have a lot more people using digital, and the ages that are using digital as well has become a lot more normalized than it was, say, sort of 3, 6, 9 months ago. We've been conducting a lot of research on this, and digital therapies require academic evidence in order to be validated. And so I think that's really a key piece in medtech that shouldn't be forgotten. The work that we've been doing has gone to demonstrate that around about 1 in 4 patients who completes the Grow Health platform is able to place their type 2 diabetes into remission. In our NHS pilot, we actually saw a 96% uptake and an 8% weight loss at 3 months, which for us was fantastic. It goes to demonstrate that if you get the engagement piece, and if you get the funnel right, digital tech can be extremely engaging and can captivate everyone, and doesn't have to leave a community disenfranchised or isolated. But almost more importantly, and I think during COVID, what is more relevant is that we assessed the impact of the platform on mental health outcomes. So for people with type 2 diabetes, obesity, and hypertension, we had been tracking their response to surveys on depression, stress, and anxiety. And within 8 weeks, we were able to see a 31% reduction in depression, a 32% reduction in anxiety, and a 23% reduction in stress, which goes to demonstrate that it's not necessarily just metabolic health or sort of physical health that digital therapies, are able to affect, but sort of at the same time, and with the same interventions, we're also able to affect other areas of health. And obviously, health is holistic, but sort of it's been great to be able to isolate the mental health outcomes and determine sort of the impact that they have. We've been conducting a binational randomized clinical trial or controlled trial with St. Clara's Hospital in Germany and Switzerland, looking at the impact of the Grow Health platform on a number of weight, gut, and mental health markers. And as I sort of mentioned, that the outcomes of the platform actually far surpass what is published. The sort of the stories of people who have literally turned their lives around from sort of quite dire situations or health conditions that they felt weren't treatable, and to be able to do that with digital technology enables us to scale this technology to reach everyone and really democratize that healthcare piece. And I think really in conclusion, just wanted to sort of demonstrate or just highlight some of the features that sort of digital therapies or digital therapeutics would contain in order to achieve personalization. And really in conclusion, digital therapies, the reason that they are so exciting and the reason that they are that they hold so much promise is that the app or the intervention that I have in my hand would be different to the app that you may have in your hand based on the language I speak or the foods I eat or the customs that I am used to. And by doing this and by using data and big data in order to achieve this, we are not only able to do it at scale, but also able to do it in a way that reaches every person on every platform, however they engage. And without a shadow of a doubt, that does leave a small community disenfranchised, those who are completely illiterate when it comes to technology, and those who don't have access, and those who don't have access to the internet. But the ability to facilitate digital therapies to those communities is something to be explored, and something that we have been exploring in places like India, in the slums, where we work with a number of partners such as Swiss Re and Samsung, looking at how we can engage those who are completely disenfranchised from not only digital health, but just healthcare in general. And hopefully I've been able to share some of the sort of the excitement that I hold for digital therapies. And if there are organizations interested in research or interested in looking at improving the health of their populations, we would be extremely interested in order to pursue that. Thank you.